Good morning, dear friends and colleagues. I am Dr. Riaz from Edapal Hospital, Edapal. We had few wonderful sessions with good interaction, and I hope all of you enjoyed them. We have covered most of the things related to non-invasive ventilation. You have these interventions be available round the clock. We need to know and maintain these equipments to optimum. In this short presentation, I would like to discuss on few practical points which will help us to make non-invasive ventilation better. This is also an area you have better experience than me, and different NICUs will have their own way of managing it. So please feel free to share your experience with us. A well-maintained chain of equipment and manpower is the key to success to any intervention. It means a perfect solution available at any time 24 into 7. Early initiation of an order reduces the time between order and its implementation. It reduces the downtime of an equipment. That means when an equipment is ideal for any reason, and proper handling and sterile techniques lead to reducing sepsis, reduce machine associated complications, reduce stress, and create a better working atmosphere and overall better outcomes. So we need to have a machine in place, the accessories in place, check for its performance and sterility, and a nurse who can manage all these things in a short time. So, if you are being prepared for your procedure, your non-invasive ventilation goes trouble-free. As we discussed earlier, we have several types of non-invasive ventilation. We can use a bubble CPAP or a HFNC. You can have a compressor-driven non-invasive ventilation, or you can use a ventilator for this purpose. For any machine you use, we have these parts: the machine, an air and oxygen source, the tubings, blender, an interface, humidifier, and other supportive systems. Then we also have the disposables and the reusables. The disposable, like the disposable tubings, the interfaces, the fixation caps, humidifier chamber, etc. And the reusables like the humidifier, the temperature probes, and the reusable ventilator tubings. Disposables are easy to use and don't mix up or miss parts. Come sterile, and you just need to check for any sterility breach and use it, but comes with additional cost. They also need to be disposed properly. Whereas reusables need to be taken care of well, need to periodically check for its performance, need to sterilize before using, and often get mixed up with parts of another set. Then you have a mixed up set which will cause confusions with additional or missing items at the time of use. In case of disposable sets, check for sterility breach and use it. And in case of reusable ones, check for sterility breach, and it is always better to keep a single tubing set in separate packs rather than keeping all the tubings in one bin. A pack should contain all the parts of the set and nothing extra. It is also good to have two sets for each ventilator so as we can save downtime, especially when you need to use it for another baby before the tubings are ready after sterilization procedures. The checklist is availability. Is the machine available now? Is it in working condition? Are all the sizes of interface and fixation items available? And above all, the staff is oriented with the place of availability, method of fixing, and can set the unit in a short time. Adequacy and pressure of oxygen and air should be checked. Adequate number of electrical points should be ensured. And it is always good to have an additional source of air and oxygen available if in need. We have a lot of wires and tubing hanging behind the crib, that of the warmer, the phototherapy unit, the infusion syringe pumps, oxygen suction tubing. They all are extra long and often lie on the floor. Make sure that these extra length are coiled and never touching the floor, and keep them also clean. Utmost care is to be taken during assembling the set to avoid breach in sterility. Avoid dropping of the tubing while handling them, and many times this happens as the tube becomes unsterile and need to be discarded. Select the appropriate size of interface so as you do not need to open more than one at a time. The probes along with the humidifier should be cleaned and kept covered when not in use. Used circuits of respiratory equipments are high risk biomedical waste. Open circuits are more dangerous than the closed and should be handled with utmost care. Adequate personal protection equipment should be used while handling them, and they should be disposed immediately and appropriately after use. Coming to cleaning and disinfection of reusable respiratory equipments, it should be initiated immediately after use. The process follows the following sequence: wash, rinse, disinfect, rinse in sterile water if chemically sterilized, dry it and store it in sterile dry packages. Washing with water and soap removes secretions and particles in tubes. Rinse with clean water and disinfect with appropriate method as directed by the manufacturer, either by heat sterilization, chemical or gas sterilization. In case of gas sterilization, you need to get those tubings dry before getting it done. Rinse with sterile water if chemically sterilized and dry it before storing in sterile dry packages. Wipe down the controls and entire outside of the ventilators with a compatible disinfectant as advised by the manufacturer. Disinfection of tubings are done as described earlier, and it is not necessary to routinely clean respiratory and pressure lines within a ventilator between patients because the lines are not exposed to the patient or the patient's respiratory secretions. Bacterial or viral filters also may be used at the expiratory end. Non-invasive ventilation is an aerosol generating procedure. Unlike an intubation or a suction, this is a continuous process and care should be taken to control aerosol spread, especially in the COVID times. Maintain adequate distancing between babies and it needs 1:1 nursing care. The personnel taking care of these babies should be using adequate personal protection equipments. PPE includes N95 mask, face shield, goggle, gown and gloves. PPE protects you but not the babies. Appropriate infection control measures should be strictly practiced. Proper donning and doffing also should be practiced as per protocol. Now to a controversial area. Can we reuse single-use medical devices? Many times we are forced to do so for financial reasons. We are not the only one who reuse single-use medical devices, but generally it is discouraged. In case you use, select the appropriate one, the one which is opened but not used, or it is less used one, looks safe, and it can withstand the disinfection procedures. When not sure, don't use it. The most difficult part is to get the tubings dry after cleaning. Anyway, we have to follow the standard disinfection procedure strictly. Hope we have covered most of the practical aspects in managing non-invasive ventilation. Thank you. Stay safe, use mask, keep social distancing, and use personal protection equipment when required. Thank you.